Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. Oops. I just had a little snack before I started the webinar tonight. Just noticed a little bit of morsels left there. But anyhow, it's been a few weeks since we've been together. I missed actually doing the webinars, but as many of you know, I was traveling back to Indiana. I did driving actually 18 hours from Austin, Texas, back to help my brothers and sisters close down my mother's house. We unfortunately had to move her into an assisted living facility. So yeah, I missed being with you all the last 2 weeks, but we're here now for 4 weeks in a row. So this is the first of 4 webinars that I'll be doing in the next four Thursday. I guess we're at Thursday here. So I look forward to spending some time with you and helping to sort through and learn more about this thing called Lyme disease. For those of you that are new here, the way that these webinars work, you create them. I answer questions, but you create them with your questions. And the way you write those questions is you go ahead and use the chat box over here, down here on the bottom, over on the right-hand side, is a chat box, and you can write questions to me through that chat box. Try to keep your questions somewhat brief. If they get too long, it's hard for me to post them. My computer gets screwed up sometimes with that. But I will post your questions, and you'll be able to see them in the live version. If you're watching this in a recorded version, you won't be able to see those questions, and so I actually do read them as we're going through them, okay? I am recording this webinar tomorrow morning sometime after 9:30, hopefully before 10:30 Central Standard Time. I should get an email out to you saying that the recording is ready and with a link to the page where you can watch that. Now, if you don't get that email, there's a number of places you can see it. Okay, so first of all, you can find a copy of the recording at the bottom of the homepage at treatlyme.net. That is my Lyme disease information site, Treat Lyme by Marty Ross MD. The other place that you can see it is at my supplement store, Marty Ross MD Supplements, on the homepage down towards the bottom, and that's at treatlyme.com. You can see it on my YouTube channel, and I also do put it on my Facebook page, my Treat Lyme Facebook page, which is at facebook.com/treatlyme. Okay, so if you happen to not get the email, there's many ways to find, to watch that recording anyhow, all right? And I think... during the webinar tonight, I'll be doing some screen shares to show you information at my Lyme disease information site. So if you happen to miss something, you can either listen to the recorded version or later on go back and read one of the articles that I've written regarding that topic too. Okay? All right. So I think we'll go ahead and get started here. So first of all, I just want to say it looks like it looks like we got a good sized crowd tonight. And I'm just quickly surveying what's been written here. All right. So it doesn't look like I have any catastrophes going on in terms of people not hearing me, at least. So let's go ahead and get started. I'm going to post the first question here. All right. This is from Megan. Hi, Megan. Hi, Dr. Ross. Hoping your travels went smoothly. They did, actually. It was a little bit of a longer trip than I anticipated, but it went very well. Thank you. Let's see, I tried Bactrim and broke out in a mild high-like rash 8 hours later. Tried rifampin, was too nauseous with headache to handle it. So are there any tier 1 antibiotic treatments for Bartonella that I could use? It seems either Bactrim or rifampin are lead antibiotics and either needs to be paired with another one for successful treatment. Is this so, or is there not any combination that may work that doesn't involve Bactrim or rifampin? I did seem to tolerate azithromycin pretty well. Okay. So what Megan's referring to is at my Treat Lyme site on my page about how to treat Bartonella. It's an article called "Kills Bartonella: A Brief Guide," and also the same information is included in my book about how do you treat Lyme. That's a book called "Anti-Germ Action Plans." I'll show you that later too. But in both places, I describe Bartonella treatments and I break them down into 3 levels. Okay, so tier 1 involves certain antibiotics, then there's a tier 2, and there's a tier 3. The strongest regimens are all in tier 1. They tend to work about 80 to 85% of the time. Tier 2 regimens work about 75 to 80% of the time, and tier 3 is about 70 to 75% of the time, all right? In tier 1, there's always 2 antibiotics that are used. Tier 1, it involves coupling Bactrim with something, or rifampin with something, or a group of medicines called the fluoroquinolones, which is something called Levaquin or ciprofloxacin. And those are in tier 1 as well too. Now you could do a tier 1 involving Levaquin or Cipro and combine those with a tetracycline, like a minocycline or a doxycycline. Okay, that would be an effective tier 1 treatment. However, I tended in my practice when I was still practicing in Seattle, Washington. Many of you know I'm not practicing now. I'm in Austin, Texas, where I'm not licensed to practice. But when I was practicing, towards the last few years, I stopped using the Levaquin and Cipro as much. Although they are effective, they are very effective. I tended to save them more as a later resort. And the reason is Levaquin especially has increased chance of causing tendon inflammation that won't go away. It just stays on even after you use the medicine, okay? And also it can sometimes cause tendon rupture, breakage of the tendons as well too. Now this happens maybe 1% or less of the time if you look at what the research says, but there's enough of a risk of it that I started not using the medicine as much, okay? So what I would do in a situation like this, if I had a patient that had an allergic reaction to Bactrim and had side effects on rifampin, I might look to tier 2. Okay, and tier 2 again works about 75 to 80% of the time. And if you're on a Bartonella treatment, if it is working within a month or two, you should start seeing improvement in your Bartonella symptoms. Okay, if you're not seeing improvement in those Bartonella symptoms, then it's time to try something else. All right, but a tier 2 treatment would be to combine a macrolide, which is Zithromax, which is one of the medicines you said you can use. The azithromycin is Zithromax. Okay, or Biaxin. Biaxin is also a macrolide. It's also known as clarithromycin. All right. So you use either clarithromycin or Biaxin, and you combine it with a tetracycline, which is doxycycline or minocycline. All right. And I detail how to do that in my article, and I'll show you that article here in a minute. That's probably where I would wind up going next. And if I were treating somebody that had this kind of problem, that is what I would wind up doing. Okay. All right. I hope that answers your question as far as that goes. Let's see here. Yeah, let me do a quick screen share here to show you a couple things. All right, so this is Treat Lyme. This is my Lyme disease information site. Okay, and again, tomorrow morning, if you don't get that email, just scroll all the way down here to the bottom, click right there. Okay, that's where you can find it. You can also find the recording here. If you click on my webinars page down towards the bottom, you'll find all of the recordings, even of past webinars. Okay. All right. Anyhow, in terms of my ideas about how do you treat Bartonella, take a look at the online Lyme guide and look under infection treatment plans. And click on my article called Kills Bartonella. And you'll see that's where I outline the various tiers of a treatment. Okay. All right, then if you're trying to figure out if your Bartonella is getting better, you need to compare it against Bartonella symptoms. All right, so in terms of Bartonella symptoms, I would take a look at this section called How to Diagnose. And there is an article I have here called It Could Be Bartonella or Babesia, the Symptoms and Signs, okay? And you could read through this and it tells you what are the symptoms that suggest Bartonella. And what are the symptoms that suggest Babesia? All right. As many of you know from following my webinars, I am not a big believer in using the testing necessarily to diagnose Babesia or Bartonella because we have too many strains of each of those germs and the testing can only find a limited number. Okay. So I tended, when I was practicing, to make my Bartonella and Babesia diagnosis based on what the symptoms told me. And also I would follow those symptoms to see, are they starting to get better? Okay, by 1 to 2 months. Keep in mind, Bartonella treatment is going to take about 4 to 6 months in Lyme disease to totally resolve. Okay, but you can start seeing improvement in some of those Bartonella symptoms by around 1 to 2 months if the treatment's working. All right. All right. Good luck to you, Megan. Thank you for that question. Hello, Alice. I read a study that said 200 milligrams per day of fluconazole for 25 days successfully treated people with neuroborrelia. I mess this one up sometimes. Neuroborreliosis. Thank you. Can you please comment? What are side effects of fluconazole? Is it intracellular? Also, have you used quercetin or monolaurin to combat Lyme in your patients? I read about it in Horowitz's 2017 book. And what do you recommend for recurring SI joint pain? Thanks. Okay, so let's start. I'll kind of work our way down. All right. So fluconazole, everyone, is also known as diflucan. It is an azole antibiotic. It comes from a family of medicines called the azoles. Okay. Within that family is flagyl, which is metronidazole. And also within that family is tinidazole or Tindamax. Okay. And both of those are really strong cyst busters. Fluconazole, because it's from that same family, even though it's designed more to treat yeast and fungus infections, it may have some anti-cyst properties to treat the Lyme disease cyst, just like flagyl and just like tinidazole Tindamax do. Okay, just so you know. Okay, all right. Now, one of the ways that fluconazole can work is there is a theory, I think some limited science, although I haven't really reviewed the science that in depth. Okay. A number of years ago, there was a protocol called the SHART protocol. That's SCHARDT or SHARDT. Google it either way. If you just write SHART protocol Lyme, you'll find it, okay? And SHART was a British physician that had come up with a protocol that involved doing, I believe it was a month on of fluconazole, followed by a month on of amoxicillin. And he would just keep rotating that. And the reason he did that protocol, and just bear with me, I'm trying to get to an explanation of your question here. What Shart believed, and I think had some science behind it, that showed that the reason he used fluconazole is that he contended that it interfered with the detox mechanisms of the Lyme germ. And so it would make it so that the Lyme germ could not detox quickly enough once a person took an antibiotic that could kill it. So it would help make the amoxicillin stronger at killing the Lyme germ when you blocked the detox mechanisms, okay? All right. Now, I don't know whether Shart's right or wrong with that, but I'm just letting you know that's a theory about it. I used fluconazole in my practice to treat Lyme and also to treat yeast. I used it in terms of treating Lyme to treat the cyst form of Lyme. I never saw when I used it for a month or more with the patient that they had resolution in their Lyme symptoms, whether it was neurologic symptoms or muscular symptoms or joint symptoms, by using it just for a month. So I'm kind of skeptical that it would be helpful for neuro-Lyme. Okay, I'm just skeptical that it would, using it just for 25 days. However, I think in the SHART protocol, I think SHART was 25 days. You're using it for 25 days, followed by about 30 days of amoxicillin. That regimen I did try maybe 8 or 9 years ago with a number of my patients, and I had some people that had some benefit from it. I think there are better ways to treat, though. Okay, all right. Let's see. What are the side effects of fluconazole? Oh, and then the way I think that fluconazole helps, maybe in treating Lyme, it kills the cyst. That may be one of the mechanisms by which it works. Okay. It does get intracellular, as you question here. Does it work inside of cells? Yes, it does. But the other thing that I think that it's doing is it may impair the detox mechanisms, making it easier for the antibiotics to work. Okay. All right. So it could be partly Shart's idea is correct, and the idea that it may be able to treat cyst. It may be those two things together that render it so it might be helpful for a person. Okay. Now I'm just speculating on that. Okay. All right. Now, in terms of monolaurin and quercetin, I tended in my practice to use those as antiviral agents because there is some natural medicine science that says that they can kill viruses. I did not find those two to be effective in terms of helping with Lyme germ treatments. Okay, Horowitz may have a different perspective on that, but that was not my perspective when I was treating Lyme, that it made any difference in terms of the Lyme germ. Okay. And then in terms of SI joint pain, so SI joint, everyone, is I'll just stand up for a minute. So that's the joint that's kind of right here, okay, right there. It's where your sacrum right there meets the hip bone, okay? And that stands for sacroiliac joint or SI joint, okay? That joint, like any joint in Lyme, can become inflamed. And so the approaches I would use for people that have joint pain of any variety would be, number one, definitely be on something that's anti-inflammatory. And as many of you know from reading my information or following me in these webinars, the biggest cause of Lyme symptoms in general, all Lyme symptoms, is that white blood cells, when they try to get rid of Lyme, make and release a group of chemicals called cytokines. And cytokines are good and bad, okay? On the good side, they help create more white blood cells. They help those white blood cells work better, okay? But in Lyme, because the immune system still doesn't do a good job, even with those cytokines being around, it keeps trying harder and harder. Eventually, it makes too many cytokines. And too many cytokines make it so you can't think. They disturb your sleep. They give you fatigue. They make you hurt all over. They give you joint inflammation, joint pain. They interfere with how your hormonal systems work. I mean, I can go down the line of Lyme symptoms. Those are really excess cytokine symptoms, okay? All right. So what do I like using to decrease inflammation in Lyme? Well, many of you know I like working with things that lower cytokines. And my favorite is to use curcumin. Curcumin is a component of the Indian seasoning turmeric. I like using a liposomal variety of it. That means it's microscopically wrapped in fat, okay? And that seems to increase its absorption. And so a general good dose of that is 500 milligrams 3 times a day. If that doesn't seem to be enough, you could even go up to 2 of those 3 times a day, okay? If that doesn't seem to be helpful enough, another option would be to use a compound that has a number of agents in it that can lower cytokines. And so, for instance, there's a product made by Research Nutritionals called Cytoquel that has a number of ingredients in it, including some curcumin in it, including some black tea extract, including some resveratrol, a number of things that are in it that all can target lowering cytokines. And that could be another option too. And that would be 1 pill 3 times a day on that product as well too, okay? All right, so it has a number of components in it that can lower cytokines, okay? All right, that might be what you should try. And then the other thing, or that you could try, I should say, those are things I have found helpful in patients in a similar situation. The other thing I have found helpful when I was treating patients that could really help with that kind of hip joint pain in some people is acupuncture. Getting needled can make a big difference for some of the joint pains that people have in this disorder, okay? All right. Good luck to you, and thanks for the question. Hello, Carly. I see a hi from you here. Thank you for writing that. I appreciate it. Hello, Heather. Welcome back, Dr. Ross. It's good to be back. Do you have an opinion on MMS for treating Lyme and co-infections? I was taking for 5 months, but became concerned about the safety of it and stopped. Thank you. You know, I never used it in my practice. I just want to let you know that. My knowledge of it is from what I read, and my understanding of it is that it has the ability, what MMS may do is something similar to what other oxidizing agent treatments do, like ozone, hydrogen peroxide, high dose vitamin C, okay? These are all oxidizing agents, and this MMS, after you take it in, creates oxidizing agents. And oxidizing agents are damage fat membranes, and including the fat membranes that make up the germ covering, okay? So they can damage germs. But the bigger concern I have is that they may also lead to some damage of our cells if we use them over a prolonged period of time, all right? So I never really saw many people get benefit from the MS. People that had come to see me that were on it, I never really saw great benefits from them taking it. But because it is an oxidizing agent, it is one of those things I would be careful using for a long period of time. Because again, we just don't have safety studies that help us understand whether these agents are good for somebody over repeated use. In other words, the damage that it's doing to the germ, it may be doing to our cells as well too. All right, so I'm hesitant to use oxidizing agents on an ongoing basis, or to suggest that people do that on an ongoing basis. Okay, all right. Thanks for that question, Heather. Good luck to you. Hello, Regina. Let's see. Can you by any chance assist us with understanding the safety of platelet-rich plasma for injuries, especially of the knee while still harboring a late-stage Lyme infection, which is almost gone? Would there be any risk with the bacteria associated with Lyme? Could there be any reactions? Thanks for all you do. Regina, every now and then I get stumped. I don't really have an opinion on this one. I need to look at it a little bit more. Could you do this for me? Send me an email just to remind me to look into this. I'll try to get an opinion for you over the next few days. Okay. So I'm just going to have you send it to the email for my supplement store, which is Marty Ross MD. So MartyRossMD at treatlyme.com. Okay. So that's TREATLYME.com. If you'd write that question to me, I have to do a little bit of looking into it. I don't have an opinion off the top of my head. Okay. All right. Thank you for that question, though. Hello, Sherry. My daughter, who has Lyme, had biomagnetic therapy in Mexico recently with very positive results. I'm wondering what you know of this therapy regarding Lyme. Thanks for all you do, Sherry. I don't know exactly how it works. I do know magnet therapy in general can help with pain syndromes, all right? As to whether it gives long-term benefit in somebody with Lyme, I honestly don't know. I do know there are some practitioners that use it. I know there's a chiropractor, for instance, over in Idaho when I was practicing out in Seattle that was claiming good success using it on his Lyme patients. But I don't have a good feel as to whether, or what I saw in his patients is that the benefits were not sustainable. All right. In other words, people may have had benefit over maybe a month, few months, but they were not sustainable. They didn't last a long period of time. All right. That's just based on observation. Okay. All right. Thanks, Sherry, for that question. Good luck. Good luck to your daughter. Hello, DJ. Let's see. Can you explain why I might have had a couple of episodes of very low platelets? 9,000 the first time, 50,000 a year later, when I got a fever with an unknown new infection, viral bacterial, while in the midst of a 2-year fight with Lyme, Bartonella babesia. This did not happen while I was treating with triple antibiotics for the first 6 months, only in the 1.5 years while treating with herbals, as in your second tier approaches. It's a good question. So first of all, even though these are herbal medicines, anything that we take, that we ingest, may potentially have side effects, okay? While I was working and treating patients with herbal medicines, I never saw a person develop low platelets while on the herbs that I recommend. That doesn't mean it's not possible. There is a rule of medicine that I have, which is anything can happen to anyone with anything, okay? All right? So it may be that you're having some slight platelet suppressing effect from being on the herbs that was made worse by having these viral bacterial infections. The actual mechanism as to why that happens, I don't know. All right, it may be some type of I would wonder if it might be some type of an autoimmune reaction where when you get a virus, you may have some tendency that the herbs might suppress the bone marrow and therefore your platelet production to a degree. And then that may get worse due to the immune situation created by having a bacteria virus. The actual mechanism, I don't know. I would be guessing at best. Okay. All right. Good luck to you. Hello, Leo. Let's see. Any stem CA. Leo, if you're looking for information about stem cell therapy, I do have an article about that, and many of you may be familiar with that. I'm just going to show it to you because I'm not sure if that's the question you have, and I'll let you digest it. Okay, so let me go ahead and show you that real quick. All right. So take a look in my the latest tab here. It's one of those articles I wrote sometime in the last few months. Yeah, here it is. It's this article called About Stem Cell Therapy for Lyme. And although I know some people do get benefit, when you look at what the research is suggesting to us, it's only a limited number of people that seem to get benefit from it. Okay. So take a look at that. You'll get a bigger understanding of the various types of stem cell therapy and how they might work. And is it something that might be useful to do in Lyme? Generally, I am not in favor of it. I'll put it that way. I am in favor of if there is nothing else that seems to be working, this would be one of those something else you might try. But I think that the data and the science that we have around it at this point does not support it being fully useful for most people with Lyme disease. Okay. All right. All right. If that's what your question is about, that's the article you can take a look at to get more information. Okay. All right. Hello. Okay. Let's see. Hi, Marty. I'm homozygous MTHFR and take Thorn Methylguard Plus. I was told to just take one, but the bottle says 3, which is correct. And do I need to take this the rest of my life? I also take quercetin 15 milligrams a day, and just read more than 1,000 milligrams can damage kidneys. Have you heard this? I have not heard that, and I am skeptical of that. I would have to see where that article might have come from. My recent reading about quercetin did not find anything to suggest that. So I would say I'm not aware of that claim. I've used it for years at doses higher than that with my patients and never saw anyone have any kidney injury problems from being on it. Okay. All right. In terms of the Methylguard Plus, I would, if you'll bear with me here a minute, let's go ahead and I got to find out what, I know Methylguard. I don't know Methylguard Plus. Let me look. I'm going to do a screen share. We're going to look at a label together. Okay. So bear with me here. Okay, so 3 capsules have 3 milligrams of methylcobalamin. And 5 milligrams of the MTHF. Wow, that's low. This is probably more than, I'm talking to myself here. 3, you could go up to 3 pills on this because the top dose that you want to do on the folate, this 5 MTHF folate that I'm circling here, is 5 milligrams. Okay, now let me go back here so I can. All right, so you want to take some B12, and I like the B12 level that's in that. The 5 MTHF, you can take up to 5 milligrams a day. It may be when we start this medicine for somebody, if we start fixing the problem too quickly, we can make a person a lot worse. Okay. And so it's possible that your practitioner had you start at 1 a day to build up slowly, working up to 3 pills a day, which would give you that full 5 milligrams of the 5 MTHF component. Okay. That may be what they were thinking. So what happens, everyone, with MTHFR? That stands for methotetrahydrofolate reductase. That's what MTHFR stands for. It's an enzyme, all right? And it is responsible for converting diet folate into an activated folate, which is called 5-MTHF. That's the kind that's in your Methylguard Plus, okay? All right. All right, now so why that is necessary is it ultimately is responsible for helping to lead to the production of glutathione. All right, so glutathione, many of you know, is a very strong antioxidant. It's made in every one of our cells. It helps fix cell damage, but it also is used by the liver as the main detox chemical. It's what's used to pull toxins out of our body. All right. So glutathione is a downstream product. It's all the way down here. All right, up the river, way up here, to start the process that eventually leads to the production of glutathione and a lot of the detox, we have to be able to take folate from our diet and convert it into the activated folate. Okay. All right. Now, if you have a MTHFR, when we test to see do you have a defect of that enzyme, what we're really doing is we're testing to see, do you have the genetic programming that will cause that enzyme to be made correct? All right. And we're looking to see what happens with the genes, the genetic material that programs that enzyme. And there are two ones that we can test for. There's one called, well, there's a number we can test for, but the two big ones are A1298C and C677T. If you look through your reports, you'll see that those were tested for, okay? Homozygous means that the mom part and the dad part are abnormal, all right? So we get our genes, we get one part from our mom, one part from our dad, all right? So if you're saying homozygous, I can't tell from your question whether you're homozygous at the C677T position or at the A1298C position. All right. Now, if you are homozygous at both of those positions, that is one time that I definitely found benefit from treating people for MTHFR. Okay. If a person is heterozygous only at one position, I never really found much benefit for treating it. And when somebody is homozygous at one position, meaning either the A1298C or the C677T position, if you're homozygous at one of those, sometimes I found benefit in correcting the problem to see if we get detox to work better. Okay. So what I started doing towards the later years of my practice is I was advising people that if they were homozygous at one of those positions, that we might try to correct it for 6 months and see if they got any benefit. If they didn't, I would stop treating it. Okay. That's how I was starting to handle it towards the end. All right. So now what happens is if you have had this blockade where you're not making enough of the activated folate, and then suddenly you start taking the activated folate, what happens is you open up all these detox mechanisms. Okay. And it isn't just glutathione, but there's a bunch of small chemicals that are made in between steps that get you to glutathione. And each one of these steps also does a little bit of detoxing too, okay? Now what happens is if you've had a damage up here and you're not getting enough activated folate, then suddenly you start getting the activated folate. It's like you take a dam of a bunch of toxins that have been built up, just build up, okay? And then you lower the dam quickly. All of a sudden you got all these toxins coming through. And that can be very, very hard to handle. It can cause a huge flare up in cytokines, actually. Okay. So people can get really sick if you detox too quickly. So it might be that your provider was just trying to start lower by not giving you too much of that 5-MTHF, because if they had gone higher right away, it just might have opened the floodgates too much. Okay. All right. I hope that gives you some insights on that. Thanks for the question, Kate. Let's see here. All right. Hello, Michelle. Let's see. Hi, Dr. Ross. I started following your protocol for my Lyme 2 months ago, and I'm feeling 80% better. Good. I'm glad to hear that. Let's see. I'm taking Doxy, NT Factor, grapefruit seed extract, curcumin, and liposomal glutathione. I was suffering from numbness all over most of my body and extreme muscle weakness. The numbness and muscle weakness have both significantly improved. Thank you so much for everything and investing your time and energy into helping people like me. I'm so thankful to feel like I'm finally starting to get my life back. I'm really glad for you. This is the reason I put a lot of my information out there, is to give people some ideas that they can work with to help improve. So great. I'm glad to hear that. Thank you for letting us know that too. Let's see. I just have a few more questions for you. I've always suffered from anxiety and depression, and the Lyme made it worse. Is Wellbutrin safe to take with this protocol? How long should, so is Wellbutrin, yeah, it is. Wellbutrin is an antidepressant medicine, everyone. And I see the mechanism by which it works. I don't see any reasons why it would interfere or be hurt by using the components of this protocol. Okay, Michelle? Let's see. How long should I be doing this protocol? So I'm going to give you some observations, okay, based on just working with people. I don't know your particular situation enough other what you put here, but I'm just going to make some observations, okay? So when somebody so in terms of, there may be a number of things that are helping you to feel better this quickly. One is killing the germ with the doxy and the grapefruit seed extract. It's possible those are helping, okay? But I also wonder if you're doing a good job of nerve repair, which is what the liposomal glutathione and NT factor would be helping with, okay? So NT factor is made up of phospholipid fats, the same kind that can be found in your nerve cell membrane. So if nerve cell membranes get damaged, you get neuropathy, all right? So you're repairing that with the NT factor. Glutathione helps repair nerves from the inside. It's a very powerful antioxidant. A liposomal variety can get inside of cells and start repairing damage from the inside, okay? Now, both of those also are helping to repair your energy factories that are found in your cells, and those are called mitochondria. And that may be helping your neuropathy too, because you may have enough energy to repair those, maybe helping your energy overall, all right? Now, in terms of the NT factor and glutathione, generally to get the maximum benefit of nerve repair as well as mitochondrial repair, the energy factor repair, I found on average about 6 months. Okay, I found that to be helpful in my patients. Okay, all right. In terms of your Lyme germ treatment, the germ killers you're using here, doxy, which is treating Lyme that lives inside of cells, it's also treating the spirochete. Grapefruit seed extract is treating the cyst form of your germ. You've got a comprehensive treatment going here. Okay. Generally, when I was treating Lyme, I would try to rotate my antibiotics about every 6 months, except when I was using an all-herb regimen of Otoba and cat's claw, I found those could be effective up to a year or even longer, okay? But with the prescription antibiotics, especially the doxy, I found it helpful to rotate that about every 6 months to a different antibiotic to prevent germ resistance from developing, okay? So that should give you some insights to think about, okay? Let's see. Yeah, so I think I've answered your questions about doxy there. How long should I be doing this protocol? I think I just answered that. Is this a long-term thing? No. I have a weird rash on my arms for months. There are little red bumps, some raised and rough feeling, and some not. They look like broken blood vessels almost. Is this common with Lyme? If so, what can I do for it? Skin is hard to figure out by description. That's something for me to give you the best idea. I would have to actually see it. And obviously we can't do that. It's kind of a format. So I don't know what to say about that. Okay. Let's see. Sharp occasional pain behind the left eye and blurriness. Had eyes checked and optic nerve checked. Everything was fine. Is this something related to Lyme? I don't know for sure it is. What I can tell you is I've had patients with similar symptoms that as we treated their Lyme longer and longer, those symptoms got better. Okay. I'm glad that you've had an eye doctor take a look at you, though. That would be an important thing to have done. Let's see. I do feel like I have constant sinus pressure too. Sometimes pressure is hard to pinpoint because half my face is numb, also on the left side. Although my numbness and muscle weakness is improving, I seem to be forgetting things more than usual, and I'm having trouble focusing on conversations. It's just everything trying to get back to normal. Once again, thank you so much. So, it's interesting when you treat Lyme, and there's a variety of symptoms everyone has. I mean, the big laundry list of symptoms. A lot of people have those laundry lists, right? Multiple things. And so what happens as we treat, not everything gets better at the same time, okay? And so sometimes there's certain things that get better first, and then other symptoms come along later. And I think what happens sometimes with those symptoms that are left, everything else is getting better, and those symptoms that are left, it becomes more glaring at you. It becomes, they seem stronger because they're much more obvious. They're not lost in the mess of all the other symptoms that are going on. That was kind of what my observation has been and was when I was treating. Okay. All right. Michelle, thanks for that question. I'm glad to see you're on your way. I think that's very impressive. Good. Carly, I see you're wanting to know if you're connected. Yes, you are. All right. Oh, I think we answered that one. Let me get rid of that. Looks like you may have posed that one twice, Kay. All right. Bear with me here just a minute, everyone. Let's see. What are your thoughts on autoimmune encephalitis treatments for severe neurological Lyme patients? My daughter's AE doctor is suggesting rituximab and plasmapheresis. LND says to go for the plasmapheresis or Plex before doing the rituximab, as infection might pose problems. Linda, I think I would need to know much more about the neurologic condition of your daughter. And obviously I can't tell from this. I would need more information to be able to tell you what is the best way to go. And I just don't have enough information here, so I'm sorry about that. All right. Good luck to you. Good luck to your daughter. Hello, Robert. See, what herbals do you favor for Bartonella? So for Bartonella, I got my insights on the herbs primarily from Buhner, as in Buhner herbs. And the two things that I found helpful out of his recommendations are to use a combination of Houtunia, that is, and Siddha Akuta. Okay. That combination I found helpful in my practice about 70 to 75% of the time. Now, I'll note that Buhner also, in suggesting those to treat Bartonella, is also suggesting a bunch of other things in his Bartonella regimen that essentially support the immune system, okay? And I don't recommend doing all those things because I recommend the Ross Lyme support protocol, which has in it things that ultimately work to support your immune system. So the Ross Lyme support protocol, my Lyme disease treatment guidelines, has information in about how do you get sleep, how do you lower cytokines, how do you support the adrenals, and help the body deal with stress with something called ashwagandha, for instance, getting rid of yeast so those yeast infections are not kicking up cytokines that lower the immune system, etc. Okay, I'm going to show you that in a minute. But in terms of the herbs that actually kill Bartonella, it would be Siddha Akuta and Houtunia. And I'm going to show you two things that you can take a look at here. Okay. All right, let's see here. Get out of that. Okay, so back in at Treat Lyme by Marty Ross MD, I would take a look at my treatment protocol. Okay, this is the Ross Lyme support protocol, and focus on the first 10 steps. All right, because these first 10 things ultimately lead to your immune system working better. Okay. So that is to do herbs that might help with sleep or prescription medicines. All right. I also like working with a paleo type diet that helps support your mitochondria. It also tends to be more low allergy. So I take a look at that too. Okay. I like having people take things to lower cytokines because cytokines give you all your Lyme symptoms, but also they can suppress the immune system. Talk about curcumin, or being on an anti-cytokine combination like that Cytoquel I mentioned earlier. Okay. All right. And then I like people being on something to help their body deal with stress. That's this ashwagandha. Figure out if you have to correct for low hormones. I give you ideas on how to do that here. Be on a good multivitamin. Consider adding glutathione to help support detox. And then I don't recommend beyond that any specific immune boosters, just because I think those steps will get your immune system working better. Okay. And then ultimately trying to see if you have too many yeast, get those out. All right. That is yeast overgrowth in your intestines. And I describe here on how to do that. Okay. All right. All right. Then, so take a look at those. You're looking in terms of herbs that might help you. All right. But then in terms of the herbal germ killers for Bartonella and how I would use those, take a look at my article called Kills Bartonella. And if you scroll all the way down here to the tier 3 treatments, there's the Hutania and the Sida Akuta and how I found them to be helpful in my practice. Okay. All right, Robert, thank you for that question. Hi, Dr. Ross. This is Chris in Florida. Hi, Chris. I think I know who you are. Thank you for all the supplements and herbs you recently sent me. I have Bartonella and likely Borrelia, and I'm taking Sida Akuta, Hutania, Cast Claw, and Atopa bark, but I'm not able to tolerate the recommended dosage. What additional herbs would help me detox besides liposomal glutathione and curcumin, which I'm already taking? Also, manifesting symptoms of too many yeast. Are there herbs that can treat excess yeast other than diflucan and nystatin? What combination? What would the combination of phytostan and grapefruit seed extract work? If so, what dosage? Many thanks. Okay. So in terms of yeast, let me just start there, Chris. In terms of yeast, the foundation of treating for too many yeast is get good probiotics in you. Okay. And I usually like working for somebody that's having a lot of yeast problems. I like using a soil-based probiotic, as well as combining it with a type of probiotic that would have some lactobacillus in it and bifidobacterium. All right. So lactobacillus, bifidobacterium probiotics, those bacteria that are in that kind of probiotic are similar to bacteria that live in. Similar to bacteria that healthy bacteria that live in our intestines. Okay. And so, for instance, one of the products I carry is HMF Forte at my store, and that is a bifidobacterium lactobacillus probiotic. Usually I have a person take anywhere from 2 to 4 one time a day of that, all right? The other thing I would do is combine something like that with a soil-based probiotic, also known as a spore-forming probiotic, okay? Spore-forming probiotics are bacteria that tend to form spores when they're not in us or they're not, and so it's kind of a protective form. All right, they come from they can come from the soil, and they may populate our intestines, but probably a way that they work is that they actually support the good bacteria that are in our intestines or that we're taking to gain a foothold. Okay, so they're more of a supportive role. And there's a couple products I carry at my store that are soil-based probiotics. One is called Proflora. It's made by Biobotanical Resources, the same company that makes Biocidin. Another option would be to take something called Corebiotic by Research Nutritionals. That's a spore-forming probiotic as well too, and anywhere from 2 to 4 pills one time a day of that. Okay. All right. Then herbally, there's a couple ways you could wind up going. One of the stronger products I like working with is a combination that has caprylic acid, rosemary oil, and garlic in it. Okay. And that a product that has those things in it is called Capri Plus. That would be a couple pills twice a day. Some people find it because it's very strong tasting, the garlic and the rosemary oil can make that very potent tasting. And so if there's a problem with that, you may want to look at a phytostan, which is another product, combination product. I tend to find that to be just a little gentler, and that would be a couple pills twice a day. Okay, those are the doses that I worked with in my practice that I found helpful for people, and those are some things you might consider. Okay. All right, then. So let me read back through here, man. See, I have Bartonella and likely Borrelia, and I'm taking Sitacuta. So one thing I would suggest, if somebody's having difficulty tolerating herbs, it is possible it's a Herxheimer reaction. It's possible. Okay. The other thing it could be is side effect. Okay. So one of the things that you might want to do is experiment, or that I would do with my patients, is experiment by stopping certain ones and then reintroduce them to see if there is a problem in terms of a side effect causing problems. Okay. And that may be something you may want to do. If I had a person in this kind of situation, I would consider telling them, in my practice, I would consider having them still keep taking the Sida acuta and the Hootenea and have them stop the cat's claw and the Otoba, and see over a week or so, do these symptoms get a lot better? Okay. And if they do, then you might want to consider an alternative to the Otoba and the cat's claw. And that could be something like a biocidin, is an herbal combination that can do a good job of killing Lyme. Maybe a little bit weaker than the Otoba and the cat's claw for killing, but maybe helpful as well too. Okay. Those are just some thoughts, Chris. Those are things that I might do if I had somebody like that in my practice. Okay. All right. All right. I'm going to do a quick screen share here. I'm going to show some people some things. All right. So I mentioned biocidin here. And if you look at my treatment protocol, you'll see that I mentioned it in there as well too. So if you're wondering what biocidin is, take a look at my chapter here called Anti-Germs. And my herbal regimens that I recommend for killing the Lyme germ is either this Otoba bark extract and cat's claw or biocidin. Okay, and I've got articles about both, about how they may work and in terms of effectiveness, et cetera. Okay, so for those of you that are not familiar with either one of those, that's where you can get some more information about those. Okay, all right. And then in terms of ideas to get rid of yeast that I just talked about, you take a look at the infection treatment plan section here, and I'd have you take a look at Kills Yeast, a brief guide, where I talk about those as well too. Okay. All right. And then just to kind of bring it home a little bit more, a lot of these supplements I'm recommending, I usually will get emails after our webinars when people will ask, where do I get it? All right. So a place, and part of the problem with supplements is there's a lot of garbage out there. I mean, there's been independent studies done going into places like GNC, Target, and I believe Walmart, it was part of this too, where a company went and they used DNA profiling to figure out if what was supposed to be in the bottle was in it. And I think it was only about 30% of the time that products often sold at those places even had the correct ingredients in them. Okay, so there's a lot of garbage out there. All right. So what I try to do here at Marty Ross MD Supplements is to work with physician grade brands. These tend to be brands that are sold to doctors' offices, except Organic India, actually the ashwagandha there is sold not necessarily to doctors' offices, but my review of it looks like it's a very good product. Okay. But what I've tried to do here is take the guesswork out of it for you by finding products and brands that have a good proven track record of getting in them what is supposed to be in them, but also of effectiveness. All right. So if you're wondering where to get things, consider it here. Okay. Anyone can shop from this supplement store. All right. And so then in terms of this Capri Plus that I was just telling you about, okay, so this is that product. Okay. And then the Phytostan that I was telling you about. That's there. Okay. And then you could look at if you're interested in seeing names of those other products I mentioned, you just go ahead and type them in the search bar here. All right. Okay. Let me go back. All right. Good luck to you, Chris. Hello, CJ. Hello, Dr. Ross. I have a question that is a bit indelicate. Sorry about that. About 5 weeks ago, I noticed my stool was speckled with small white spots. It occurs with every stool daily. The stool itself is normal color and consistency. The specks are the size of a punctuation, a period, or a dash. My LMD has no idea what it could be and could not recommend any testing. My diet and supplement regimen has not changed. Thank you for your opinion. And ONP came back Negative times 3. Okay. So the so ONP, everyone, stands for ova and parasites. It's a test of the stool that we do to see, are there parasites in there? Okay. And basically what we're looking to see when we're trying to see if somebody has parasites in them is we're looking to see, do they have the eggs and or do they have full forms? All right. Now I'll let you know, there's been studies done looking at how useful studying poop under a microscope is at determining if somebody truly has a parasite infection. All right. And the studies that I saw range anywhere from, those stool studies are successful 30%, maybe 30%, maybe 50% of the time. All right. In other words, the stool studies miss a lot of parasite infections. Okay. So it is possible you may be having some type of a parasite infection. It's possible. All right. What I would do in a situation like this, if I had somebody in my practice, I would have gotten the ONP studies. All right. If the standard lab ONP study came back negative, I might then, before proceeding, do another test. And that is, I would work with, I was working with a lab called, I'm blanking. They used to be called Greater Smokies, and they're now called, hold on here, just a minute. I'm going to do it. Bear with me a minute. I'm just going to do it. I've got to Google something here. Genova. Okay. All right. So what you talk with your provider, okay? And what I have done in a similar situation like this is I would contact the lab called Genova Diagnostics. They're out in North Carolina, and they have a very comprehensive stool test that is more comprehensive than doing the ONP. Okay. They have the ability to find parasites that the standard lab does not have the ability to. And I might consider having them run their diagnostics on that. Okay. That would be our start first. Now, if that came back negative, then if I were treating you, what I would have done with you in my practice is I might try to either use a 2-month course of biocidin to treat for possible parasites, because it can also treat for parasites. Or I might have tried a 3-week course of doing something called Alinea. Alinea is a universal anti-parasite medicine. It will kill anything, okay, the way that it works. All right, now, if your stool study from Genova comes back negative, why am I suggesting you might want to consider still taking things to kill parasites? Well, the reason is even Genova, which is a better lab, may still miss it if it's there, okay? And if you have ongoing parasite infections in the intestines, it is possible that they become a source that triggers your immune system to keep making too many cytokines, all right? And as many of you know from watching my webinars over time or reading my website, you know that I think the main reason people are sick in Lyme is they have too many cytokines, right? So Lyme can cause the immune system to make too many. But we have to look at other things that might cause the immune system to make too many parasites. And one of those can be, cytokines. And one of those can be ongoing occult hidden parasite infections. Okay. All right. So let me just show you an article that you can look a little bit more about that idea here. Okay. Do a screen share. All right, so take a look at the how to diagnose chapter. Well, it doesn't look like I added it there. Here, let me see where I put it here. There it is. All right, so this is an article I have about how do you consider, when to consider treating parasites. I even review some of the science. It says, I guess it's on, that you can, these can be missed by the laboratory. I talk about testing, and then I go through various regimens that you might consider using to treat, including the biocidin that I just recommended too. Okay. All right. Let's see here. Okay. All right, CJ, I hope that gives you some information to look at, okay? All right. Hello, Justin. Hello, Dr. Ross. Thank you as always for your supplements stored in these webinars. You're welcome. You have been very helpful in my treatment. I have 3 questions. How long should Lyme treatment antibiotics be pulsed? Should I take ashwagandha and curcumin at the same time? How long should cryptolepis be used? Thank you so much. All right. So cryptolepis, everyone, is a herb that is used to treat malaria, actually. But as many of you may know, when we're treating for one of the Lyme co-infections called babesia, we tend to use antimalarial agents, okay? All right. And that's what seems to work for them, all right? So in terms of treating for babesia, what I have found helpful is to treat for at least 4 to 5 months, all right? The reason I treated for 4 to 5 months is that I found a significant number of relapses if I didn't go that long, all right? But also there's a reason for it too. And that is, or there's a rationale for it, okay? And that is that babesia lives inside of red blood cells. And the red blood cells in us have a lifespan of about 3 to 4 months after they're made in the bone marrow, all right? And what we want to do is not only do we want to kill babesia in living red blood cells, but we want to make sure that they don't pass it on or seed the new ones that are growing, all right? And it seems to take about 3 to 4 months for that to happen. So I used to treat for a minimum of 4 to 5 months, all right? That's what I was doing, okay? So how long to take cryptolepis? I would say a minimum of 4 to 5 months, but also you want to take it as long as you're still having babesia symptoms, you might want to consider taking it, okay? At least that's what I would do with patients in my practice, okay? All right. Let's see here. Number 2, should I take, okay, so ashwagandha and curcumin are useful. Both of those are useful in Lyme, okay? And I have recommended them because, number 1, ashwagandha is known as an adaptogen. It helps the body deal with stress, okay? And believe me, when you have Lyme, you've got a lot of stress going on, okay? Ashwagandha also, based on animal studies, it showed to help thyroid function work better and to help the adrenal glands work better, okay? All right. Curcumin is useful in Lyme because it can help lower cytokines, okay? And so both of those are helpful things to do. Support your adrenals, help your body deal with stress, that's ashwagandha. And curcumin is useful to lower cytokines. They both are essential components of my Ross Lyme support protocol. I find that both of those, in working with my patients, both of those were helpful, okay? All right, let's see. How long should Lyme treatment antibiotics be pulsed? A lot of that depends on which pulse regimen you're doing, okay? So there's different ways to pulse Lyme antibiotics, all right? The idea to pulse antibiotics, pulsing means starting and stopping, everyone, okay? Now, for those of you that have heard me talk about pulsing, you know I don't think it's a good idea when we're treating for Bartonella or we're treating for babesia. And the reason I don't think it's a good idea in those situations is that both of those germs replicate quickly, like about every 24 hours, those germs are replicating, okay? So if you start and stop, you're going to have the germ coming back, all right? Lyme, on the other hand, is really slow growing. And so it's okay to stop your antibiotics for long periods of time, all right? So one of the ways that I was pulsing antibiotics is based on an idea I learned from Dr. Boroscano, who was one of the Lyme pioneers. And what he had come up with is the idea that after you've been on antibiotics for a long period of time, sometimes the germs just started ignoring it, okay? And we now know that that's a situation called a persister state, okay? So Lyme germs, after they've been exposed for a long period of time, have the ability to turn into persisters. And according to some Petri dish experiments, about 20% of Lyme spirochetes and Lyme cyst will take on a persister state when they're exposed to ongoing antibiotics. 20%, okay? Not all, but 20%, okay? And what was shown in, and what a persister is basically it's a form of the germ that goes into hibernation and just starts ignoring all the antibiotics around it, okay? Now, because it's still there, though, it's inflaming the immune system, which keeps producing too many cytokines, and so you still stay sick, okay? All right. So in one of the experiments, that was a petri dish experiment, they were able to show that by starting and stopping antibiotics 4 times, 4 cycles of starting and stopping on a petri dish, they were able to completely wipe the germ out and not have it come back at all. No more persisters, no more non-persister forms. All right. And so that had a lot of people thinking we should be pulsing all our antibiotics for Lyme. We should be putting people on regimens that would start and stop, and that might take care of it. Okay. So one way to do that, there's what are known as short and long pulses. Okay. Short pulse, I would use a regimen of 4 days on, 3 days off. Now, even though in theory, according to Petri dish experiments, that seems like it should be a great idea, I didn't find many people had benefit from it. I found maybe about 20% or so of people had benefit from pulsing that way. Okay. Another way I found helpful to pulse with greater benefit was based on Burriscano. And back to Burriscano, okay? And that was what he was doing is he was stopping antibiotics for the Lyme germ until a person got really sick, and then he would restart it. And it wound up being a cycle of about 2 months off antibiotics, and then they would be on antibiotics for about 2 months, roughly, okay? So and what he was doing, he theorized that when you stopped antibiotics long enough, the germ would come out of this ignoring the antibiotic state. We now call that persisters, and that it would start growing enough that the antibiotics could work again. Okay. And I think he was probably right. I don't think he was using the right term, but we now call those persisters. All right. So using his theory in my practice, I helped a number of people get better by doing 2 month on, 2 month off regimens. And I would try that for at least 4 rounds. All right. So that means a round is 2 months on, 2 months off. So that's 4 months for 1 round. And I would do that 4 times. All right. That's 16 months. Okay. So it depends on what you're doing. If you're trying the short pulse, like a 4 on, 3 off, I think if you're going to find benefit, you should be starting to notice it within about 2 months. All right. And if not, you might want to resort back to taking, if I were treating you, if you were my patient, I would look at doing, or if I had a patient in this situation, I would look at after 2 months of not having benefit on a short pulse and just stopping it and going back to continuous. Okay. On the other hand, if I was doing a 2 month on, 2 month off regimen as a persister Lyme regimen in somebody, I would want to start seeing some improvements by the 2nd or 3rd rounds. And if not, I might stop it then. Okay. And again, a whole round is 2 months on, 2 months off. Okay. All right. That's a lot of stuff. Let me show you a couple articles to take a look at here. Okay. All right. So take a look at my infection treatment plan section again. Okay. All right. So take a look at this article called How to Treat Persister Lyme, What Works. Okay. And in here, I look at a number of things, and I talk about the Northeastern studies. I talk about a number of things. I talk about Burriscano, for instance. And in here, I talk about the long pulse regimen that I was just talking about. That's a Burriscano approach that I mentioned here. Okay. The other thing you might want to take a look at is I do have an article on pulsing called How to Pulse Antibiotics for Lyme. And it talks about both short and long-term pulsing in here as well too. Okay. All right. So take a look at both of those. Those will give you some insight then, further insight than what I just gave you here. All right. Justin, I hope that gives you some information to look at. Okay. Hello, Byron. Let's see. Hi, Marty. I'm a huge fan of your work, and thanks for helping this community. You're welcome, Byron. I was diagnosed with Lyme in September 2018 and put on Doxy, then added rifampin and Malarone. November 2018 to treat co-infections, Bartonella babesia, and have been on them currently. I took a week break of all meds in February for a week, and the dizziness and neurologic symptoms came back. Does this indicate the medications aren't working, and should my MD change the meds, or is the protocol too short-lived? How do you know if the medications aren't keeping is down but not actually treating it? Also, can you add any yeast protocols while on the antibiotics? All right, let's see here. It's a lot of stuff you just asked there. Hold on, I want to just dissect the question here again. Okay, so you added rifampin and malarone in November of 2018. So that would be, I'm just going to say all of December, January, February, and now we're into March. Let's see. Oh, you took a break in February. Okay. All right. So here's the problem. And I'll just throw this out. I mentioned it earlier tonight too. The problem with interrupting a Bartonella and a Babesia treatment in the middle is that the germs replicate quickly and they come right back. Okay. You can interrupt a Lyme germ treatment, as I said, and you can do it even up to 2 months. What I found by doing that is that often it would take about 4 to 6 weeks before a person would start getting increased symptoms on their Lyme germ antibiotics. Okay. But Bartonella and Babesia, if you come off of those and you're in the middle of a treatment, they're going to come back pretty quickly. And so my experience is it is not that the medicines weren't working, it's that you interrupted a treatment before its time was up. Okay. So on average, to treat Bartonella is 4 to 6 months. And on average, to treat Babesia is 4 to 5 months. So in other words, you interrupted, unfortunately, it sounds like the treatment was interrupted. And what I found for both Babesia and Bartonella, if that's what you have, that you almost have to go back to ground zero in terms of your timeline again. That was my experience in the patients I was managing back in Seattle. Okay. All right. So that may be what the problem was there. So no, it doesn't indicate they weren't working. It just may mean that you interrupted the treatment before its time. Okay. All right. Good luck to you, Byron. Oh, let's see. So about yeast protocols and while treating Babesia and Bartonella, it is possible to add a yeast protocol when you're treating Bartonella, Lyme, and Babesia. The complication with this regimen is that the rifampin and the malarone both may have potential to inflame the liver. And a lot of the prescription medicines that we might use to treat yeast, like diflucan, the azoles, diflucan, Sporanax, itraconazole, ketoconazole, the azoles may all lead to liver inflammation too. So what I would do in a situation like this when I was treating people is I might consider going more herbal as an option, okay? Or I might consider if I needed to treat yeast and somebody on this kind of a combination and I wanted to still keep them on a malarone and a rifampin, then I would try to look at using a compounded anti-yeast medication called amphotericin. It is a medicine that if you read about it, you're going to think I'm nuts for talking about it, but it's designed to only be given IV. Okay. When you take it IV, which is not what I used when I was treating Lyme, I was having people take it orally, but it's only manufactured for IV administration. And in an IV form, it is very toxic to the body. Okay. But in an oral form, if you have a compounding pharmacy make it up, it does not get absorbed in any substantial way. It stays in the intestines and essentially is just not absorbed into the bloodstream at all. Therefore, it tends not to have systemic toxicity. Okay. And so if I had somebody that was already taking a bunch of medicines that I did not want to interrupt that might be inflaming the liver, and if I needed to treat yeast, I might look at doing an amphotericin, because it does not inflame the liver. It stays just in the intestines. Okay. Now the downside of an amphotericin, it works very well. But the downside is it can take about 2 months of it to completely get yeast back under control. So it takes longer than the prescription options. And in a compounded format, the compounding pharmacy that I was working with in Seattle, Washington, that compounding pharmacy was compounding it for $260 a month. Okay, so it's not inexpensive stuff to take. Okay, if you want more information about amphotericin, let me just show you where to take a look at it. And obviously, this is something you need to talk to your doctor about too. I would take a look at my section here on yeast and take a look at this one called Kills Yeast, a Brief Guide. And then in this article, you will see information about how to use amphotericin. Okay, all right. All right. Thanks for that question, Byron. And good luck. Hello, Michelle. What helps vocal cord tremoring, which makes it difficult for me to speak? So, Michelle, I don't know. I would want to know a bit more what's happening with you neurologically, okay? That would be where I would start, meaning overall. How are your arms and legs working? Can you feel things? Are you having tremor anywhere else, okay? But what controls tremoring of the voice is the nerves that make the vocal cords work. And I would wonder if you have infection like a Lyme or a Bartonella that are infecting the nerves, making it so they don't work correctly. I'm not sure if you've ever had a neurologist take a look at you or an ear, nose, and throat doctor take a look at you to see if that is what's happening. But you might want to talk to your doctor to make sure that they've confirmed whether it is neurologic effect that's causing that, okay? Now, if the nerves are injured, and that is giving some of the problem, things that can help with that is to repair the nerves, okay? And there are some things that can be done about that. The other thing is when you get into neurologic symptoms like this, think Lyme and think possibly of Bartonella. So the question I would raise is, are you treating those? Do they need to be treated? Okay. That's something you'll have to consider with your physician as well too. Okay. Things that can be used that help repair nerves after they've been injured is to fix the cell membrane. I talked about this earlier using something called NT factor. It repairs the cell membrane. I like having people take glutathione because that also is a strong antioxidant that repairs injury to cells from the inside, okay? And if the injury was really bad or they're really having some profound problems, I might use also something called coenzyme Q10, okay? I'm going to show you an article where you can look at this in more detail. All right, so take a look at my section, my brain and nerves chapter. And take a look at this article called Neuropathy Repair, Heal That Tingling, Numbness, and Pain, where I talk about how do you repair injured nerves, basically, okay? And the first thing you'll see that I put here, I say, treat your infections. Make sure it's not Bartonella, okay? All right. If you have that, all right. And then there's even a video here about how do you repair nerve cell and mitochondria damage. And I talk about NT factor up here. I talk about glutathione here, and I talk about CoQ10. Okay, all right. But take a look at this article. You'll see some ideas on that. Okay, all right. Oh, excuse me. Hello, Colleen. Let's see. I notice a lot of people who treat naturally use muscle testing. What LMD would you recommend for someone who wants to treat as naturally as possible, but who isn't interested in muscle testing? No offense to people who do muscle testing, just not for me. Are there any MDs you recommend who treat naturally? I'm in New York, but could travel. Thank you, Dr. Ross. I would, in New York State, obviously there's Richard Horowitz. He works with a lot of natural medicines. He also does a lot of prescription medicines, but he's an option. There are, up in Rhinebeck, New York, there are There's a physician named Stephen Bach. There's another Bach that's up there too. I think one or both of them are members of the ILADS board of directors before too. But those are some places you might want to consider starting. Okay. All right. Good luck to you, Colleen. Hello, Mark. Let's see. Hello, Doc Marty. Thank you for these webinars. My wife is as extremely sick as when we first met. I'm sorry. Dr. Neal has taken her off any killers and binders for Lyme and mold for the last 60 days. She is no longer able to tolerate any cholestyramine nor any glutathione. She has not been able to go on any of Dr. Neal's protocol without setbacks during these last 2 months. We consult with him once every 4 months, so we have a question. Doc Neal is only treating her with phosphatidylcholine, and we are just up to 3 cc's. She had worked up 4 cc's, but that caused a herx. It scares her to only be at 3 cc's. What is phosphatidylcholine supposed to do for her? What benefit should she experience if it is working? She's not sure if she should wait for her period of time before trying to go up another cc. What are the signs for going up? Thank you again for your kindness and compassion. We are so grateful. So I'm really sorry to hear this, Mark. I know that she's going through some tough times, and I know you are too then. So the phosphatidylcholine is a fat, and I know that Dr. Neal, as you're calling him, likes to use it to help repair injury to fat membranes, the cell membranes within the body. That's one thing that it can do. And it may also be helping to dislodge toxins that have fat toxins that have gotten into the fat membranes of the body as well too. I believe that's what he's using it for. Okay. And so because it can dislodge fat toxins, and we know that that could flare up your wife, using it at a level that she can tolerate is probably more important than going up too rapidly. Okay. And I say this from having worked with both of you before. And I'll just throw that out, that I think that less is best. And I know that seems to be what Dr. Neal is talking about doing here and now at this point with her as well too, is just pulling back all the way to see if we can get, if he can get some things quieted down. Knowing her from before, that sounds reasonable to me. And also knowing her and how she might have reacted to things in the past, slow is better than going fast. Okay. All right. I hope that gives you some insight, Mark. Tell her I said hi. Okay. Hello, Diane. Let's see. Herxing from glutathione. Any suggestions? Yeah. So herxing, let me clarify what herxing is and what probably is happening here. Okay. So herxing means that when you start killing germs, the immune system sees the dead bug parts and also toxins and reacts by making more inflammatory cytokines. All right. So a herx is an inflammatory reaction to killing germs. That technically is what a herx is. Okay. All right. Now, when you use glutathione and start detoxing, sometimes that can trigger more cytokines to be made. But that's because of detoxing. So it's not due to killing germs. So technically, a cytokine flare from using glutathione is not a herx reaction, although the outcome is the same. Moving toxins too quickly in the body can trigger more inflammation cytokines to be made, okay, which can look like the same thing that a herx does, which is too many cytokines get made, but in a herx, it's because you killed germs, you were killing germs, okay? So if you're herxing, quote unquote, or having a cytokine flare from being on glutathione, that means that you may need to slow down with how much you're using. You may be detoxing too quickly in a way that may be triggering cytokines to flare. Okay, so in a person, that gets worse with glutathione going up, not you specifically, but any person. If you're taking glutathione and you get a lot of more body pain, a lot more tired, a lot more confused, that can indicate that there is an excess amount of cytokines being made from moving the toxins out too quickly. All right. So the solution is to back down, not take as much. At least that's what I would find helpful in my practice. Okay. All right. Good luck, Diane. All right, everyone. That's it for me tonight. I know it's 7:26, but I'm pooped. I'm going to call it quits for this evening, okay? So we'll take up again in a week with another webinar. Here in a second at the end of the webinar here, I'm going to transport you over to Treat Lyme if everything goes the way it's supposed to here. And from, you're going to land on the home page, but if you want to sign up for next week's webinar, click on the webinars page in the navigation menu up above and sign up. Go into that page down towards the bottom of sign. Click the link to sign up for next week's webinar. Okay, somewhere around 9:30 to 10:30 Central Standard Time tomorrow morning. If everything goes as planned and there aren't any technical glitches, you should get the edited version of tonight's webinar, the recording for that. Also within that email will be a link that you can use to actually sign up for next week's webinar as well too. I've enjoyed being back here with everyone again. Look forward to seeing you all next week as well. Okay. Good night, everyone.